Good afternoon, everybody, and welcome to this webinar led by the HESTIA Network on aligning the health, environmental and justice co-benefits of housing design and retrofit. In the mad rush up to the festive break and spending a bit of time with HESTIA and some of the other sister networks that I'll introduce shortly, this webinar is part of a UK IEG webinar series on healthy indoor environments, and that is in partnership between the EPSRC micronetworks and the Leeds Healthy Building Networks. In terms of running order, we're going to have a bit of a context behind HESTIA, what the network is, where it came from, and links to ongoing similar research in this area. But a few then short presentations from related projects before a keynote from Dr. Tiffany Yang on inequalities in indoor air pollution from 309 born in Bradford homes. So as a bit of context for HESTIA, homes are responsible for a significant proportion of UK carbon emissions. It's around 20% of total UK greenhouse gas emissions, which means that dramatic change is required to meet our net zero targets, particularly from the housing sector. There's a large-scale engineering and technological approach that's already underway to meet climate targets. This is primarily through whole building and fabric first approaches. For example, the Climate Change Committee estimates some 15 million homes require insulation and around 8 million draft proofing, so it's really big numbers. However, these interventions currently pay minimal attention to their effects on indoor environmental quality. That includes physical and mental health and well-being and questions of equity. So we know that housing is a significant determinant of mental and physical health, and it's also a key focus area for the UK to reduce the health burden on the NHS. It's estimated to be at something like £1.4 billion per year. There's large numbers of people living in homes which are not conducive for human health. So, for example, damp and mould remains prevalent in between around 1 million to 6.5 million homes in England. And the figure on the right shows some analysis from the Institute for Health Equity showing the percentage of non-decent homes, so homes not meeting the decent home standard, on the vertical axis. And on the horizontal axis, this split over the years 2010 to 2017 by different types of tenancy. So while it does show that housing conditions have improved, there is still a large proportion of homes in England that are in a poor condition. Now, broadly taking these two things together, it seems clear that there is a need to align health and environmental co-benefits, but the sort of large numbers of people living in homes at the moment that aren't fit for human and climate health is concerning, and these homes are not resilient to changing conditions. Now, we know from a lot of research that actions taken to make homes more energy efficient are going to require higher levels of air tightness to prevent heat loss. If this is done without adequate ventilation, it may end up worsening health through degrading indoor air quality, which is why you may often hear the moniker of we should be designing buildings that are airtight and ventilate right. The example on the right is from Dr. James Milner's group, showing this sort of relationship for the pollutant radon, which is a significant potential source of indoor air pollution and the second leading cause of lung cancer in the UK. The figure shows the change in life years lived across the population on the vertical axis, where a negative figure indicates a loss of life years, so a bad thing, and on the horizontal axis, a projection up to 110 years into the future. Now, you'll see 4 different lines here. There are which show different scenarios. So scenario 1 for air tightness shows a significant reduction in life years. Scenario 2, air tightness and some purpose-provided ventilation shows a reduced reduction in life years, but it's still a negative scenario. And it's only scenario 3, which has a positive one, which is with mechanical ventilation with heat recovery. So sort of key point here is that we need to be careful when designing and retrofitting homes to not build in poor health. Now, at HESTIA, one of the main things we want to do is add another co-benefit to this equation. We want home design and retrofit to align health, environmental and justice co-benefits. as we know that poor quality housing is not shared equally across society. So, for example, the damp and mold figures that I presented a moment ago, the figures for the poorest groups are something like 4 times higher rate of damp and mold for the poorest groups compared to richer. And there's a wealth of evidence showing that people in private and social rentals are more likely to live in a home with damp and mold compared to owner occupied. Now, one of the things that we will be doing within HESTIA is using the idea of a just transition, which is prevalent in thinking about net zero to ensure no one is left behind in decarbonisation. At the level of the home, this requires thinking about whether decarbonising housing increases or decreases health inequalities and therefore acting appropriately. So that's the whistle-stop tour of the context of where HESTIA came from in thinking about how we could build a team to address this sort of health, environmental and equity co-benefits. We wanted to establish an interdisciplinary network, so covering some of the main disciplines researching this: engineering, the built and natural environmental sciences, health and social sciences, but also to bring in a lot of people who have expertise of leading large research projects, but also have experience of developing future leaders through platforming early career researchers. And I'm an early career researcher myself, and there are several others that are involved within HESTIA. I also wanted to mention that HESTIA didn't come out of nowhere. There was a really large investment by UK research and innovation through the Clean Air programme to develop clean air networks, and 3 of the leads of these networks are involved with HESTIA. So Suzanne Bartington led Transition, which was looking at outdoor air quality challenges across UK surface transport. Kath Noakes was leading Breathing City, which was about developing a technical framework to integrate health evidence into urban building design. And Ruth Doherty was leading HiCam, which was developing indoor and outdoor air quality solutions as we transition to a low carbon future. And several other people involved in HESTIA were also members of these networks. A little bit about who we're working with. We're very grateful to our project partners for supporting us on this journey. And we've got some across housing, health, policy industry, and the voluntary sector. We also have a wonderful advisory board that includes government, industry, academia, and PPIE representatives, also some international representation. And they're helping us to identify new directions and develop further collaboration opportunities. And I'm delighted to have our project partner, Braun in Bradford, presenting with us today. Just a few slides on our aims before I pass over to some of my HESTIA colleagues. The sort of overall goal that we have is co-developing what we refer to as a health equity centred approach to home design and retrofit. So this will be very much about getting those 3 co-benefits that I mentioned. That will be facilitated through these 3 overarching principles: technology, health, and equity and justice. And to sort of work with those, we've got 3 scientific themes that different members of HESTIA are leading, which are about creating working groups to focus action and developing outputs that are most appropriate for those sectors. And I'll now go through a few of these these scientific themes and enabling pillars, to give a bit more information about exactly what they mean. So I'll now pass over to Rajat Gupta, who can talk us through integrated technology solutions.
Thank you, Doug. So I'm presenting this on behalf of Alejandro, who's leading the first scientific theme on integrated technology solutions. So we know that delivering low carbon, healthy and equitable homes through design and retrofit requires integrating multiple technologies rather than isolated interventions. We also know that current approaches tend to focus more on building fabric and system upgrades, although there are significant additional opportunities through household level technologies, which can affect both climate outcomes and health equity. And some examples are replacement technologies, smart devices, and consumer products. We also know there's a key research challenge in understanding how these different technologies within homes influence health and environmental outcomes, including where these technologies could be mutually reinforcing and where trade-offs or conflicts may arise. And evidence suggests that replacing gas hobs, for example, with induction cooking can deliver improvements in indoor air quality and equity outcomes. We also are observing a rapid growth of sensor and app-driven technologies that can offer new opportunities for not just improving public understanding, but also a more localized user control of the indoor environment. And to give another example, consumer products such as air cleaners, humidifiers, dehumidifiers, air fresheners, and even portable heating devices can enable individual-led actions to improve their environmental quality and also improve their energy efficiency. So we think this is a quite a rich scientific theme, which will have lots of work that will be shown later on. Okay, I'm going to hand back to Doug now.
Thank you very much, Rajat. Yeah, our second scientific theme is looking at human and social interfaces. So this is the theme that I will be leading. And, we've got a wealth of studies showing and demonstrating the importance of the interaction between technologies and people on indoor environmental quality. Several projects through the Clean Air Programme, I think we'll hear a bit from Ingenious in a moment, have provided a lot of data on the variability in indoor air quality in particular between different homes. But I think really what we want to do within this scientific theme is dig into a bit the acceptability, uptake, and real world interactions with some of these different technologies that Rajat has just mentioned, because ultimately how people interface with these technologies will determine the success or failure of different engineering interventions. I'm now going to pass over to Rajat again, who will talk through the scientific theme that he will be leading.
Yes, thank you, Doctor. So I'll be leading the third scientific theme on enabling future policy and practice. We know that policy, regulatory, and practice failures have occurred, and they've combined to produce serious and sometimes fatal consequences, as we observed in cases such as Grenfell Tower fire and the death of Awar Bishop following exposure to mold. We know that current housing policies and regulations can both enable and hinder the delivery of healthier, fairer, and more environmental sustainable homes. So there's a need to identify where these existing frameworks fall short, how can they be improved to better protect health and equity. We know that public bodies such as UK Health Security Agency and the Building Safety Regulator require more robust interdisciplinary research evidence to inform their policy and regulatory guidance. And we believe HESTIA will develop this roadmap for future research and innovation that will address these gaps in current advice and guidance. We'll ensure that the engineering and technological interventions in homes prioritize human health, environmental sustainability, and equity. And as part of that, we plan to deliver policy workshops to translate the network findings, the sandpit feasibility study outputs into actionable policy insights, supporting the road bank development. And alongside, we will also be hosting policy and impact training through targeted events on policy-facing research, including writing briefing notes, exploring also short two-way secondments between academic and partner organizations to build those skills and networks, especially for early career researchers. I'm going to hand to Ruth now, I think, to speak.
Hello, everyone. So Kath Noakes and myself are in charge of the building the community theme within HESTIA. And HESTIA is part of three networks altogether working in very similar areas. We've got Bruno and I think Abigail's here, or one of her colleagues. And so it's great that we're all starting off thinking about working together and synergies. We want to be part of an interdisciplinary, so really important that EPSRC is tackling indoor and outdoor air quality together in this network. An interdisciplinary and cross-sectoral community. Very much at the heart of that is an inclusive community where people can feel their disciplines and everything else they have a home in. And this is about thinking about these engineering technologies and how they are going to be practically implemented, keeping health the focus. And now we're really looking to start up, work with the other networks and create this community of researchers from research institutes, universities. We've got project partners in industry and government, local authorities, housing associations, advisory board, and we'll be thinking about how to co-create and design priorities and outputs. And how are we going to do this? I guess that's the most important point. I guess this is the start of a webinar. we'd really like to have in-person assemblies. They work really well on HiCam. We'll have the sandpit, and we're just currently working through newsletters and social media. So I think I'm handing you back to Doug now.
Thank you very much, Ruth. It's a very brief handover because I'm now going to pass over to Helen, who's leading the facility.
Lovely, thank you. So as Ruth mentioned, we're really keen to bring people together from these different disciplines and sectors, and also those with real world experiences, to really move the dial on this work. So we really want to accelerate research to improve home and indoor environments, to hopefully then also benefit the physical and mental health of people living in those environments, and make sure that's just across all sectors of our society. So we're going to do that in a whole range of different activities that Ruth just touched on there, and we're in the process of recruiting our public members. So that's something that Suzanne Bartington is leading on with me, to make sure we've got the right people in the room to make this happen. So one of the things we're going to be doing, and we'll be doing this in kind of springtime in 2026, is bringing everyone together into a sandpit. So you can see a lovely depiction here in the image of everyone working literally in the sand. We won't be having real sand, but we will be bringing people together in person from different disciplines, from different sectors, from different stages in their careers, and we're really keen for those earlier in their career to really pioneer some of this work, bringing them together to really start talking to each other, to develop the ideas that are really going to push this work forward and across the health, technology and equity and justice sectors. So we'll have a sandpit, get people to come together, think through some ideas, and then we'll give them a month or two to really work on those ideas outside of that space, to develop funding applications that we'll then review together, and we'll hope to award about 2 kind of largish grants to run for about 9 months, and a couple of smaller awards for 6 or less months, really to start doing some proof of concept work, and just to even just bring people together to have kind of longer term conversations that would then feed into much larger grant applications to really influence policy and practice in the future. So watch this space. A bit later in January, we'll be launching the call for people to join the sandpit, and then subsequently people from that and outside of that can apply for these grants. So we look forward to working with you and finding out what ideas are generated from this. So I think I'm passing on to Amber to talk specifically about early career researchers.
Thanks, Helen. Yes, so our enabling, one of our enabling pillars for HESTIA will be developing future leaders. And myself and Anna Mavrogiani will be leading this, and we'll be doing so through a network of early career researchers, or ECRs. So we're keeping this as a quite small network of PhD students and postdoctoral researchers, shadowing the network that was the ECR network that was running through the HiCam network that Doug mentioned earlier. So it's an opportunity for early career researchers to build interdisciplinary relationships, and to be supported by other members of the HESTIA team. When we really want this to be led by the ECRs themselves, and some of the potential activities that we might be doing could be grant writing workshops, support with fellowship applications, and collaborative paper writing. So I've got a screenshot on the screen here of an output that we had from the HiCam ECR network, which was an interdisciplinary paper written by the ECRs, titled 10 Questions Concerning the Future of Residential Indoor Air Quality and Its Environmental Justice Implications. And this is a great example of some of the work that can be done within the ECR network that we would like to replicate within our HESTIA network. And hopefully the ECRs will also be able to be involved with coordinating some of HESTIA sandpits and generally gaining skills that they otherwise wouldn't have done without being part of the network. And I think I'm handing back to Doug now.
Seamless, thank you very much. I'll just very quickly present this slide. We'll be publishing the presentation on YouTube following, so I just encourage you to look at these other projects that have clear corollaries with HESTIA. We're going to hear from a few in a moment from the hubs, so Hearth and INHABIT, as well as from the micro networks, and then from Tiffany Yang on one of the NIHR Healthy Homes projects. But just to show there's a lot of momentum going on in this space, and the projects are really trying to work together to minimize duplication. I'm going to hand over now to Rajat and then Ruth for a very brief overview of two of the larger resource projects that are going on in this space now. So I'll pass over to Rajat for Hearth.
Thank you, Doug. So Hearth stands for National Hub on Net Zero Health and Extreme Heat. So this is one of the 7 transdisciplinary hubs that have been funded, especially addressing the extreme weather challenge area, which we interpreted as extreme heat and co-occurring events. So the aim of Hearth is to assess and realize the health co-benefits of net zero transition and reduction in health risks associated with extreme heat for vulnerable communities for whom we believe evidence is lacking. By vulnerable communities, we believe we include those who are the elderly, over 65s, with chronic illnesses, those in confined environments, pregnant women. And the settings that we intend to study are homes, care settings, prisons, and hospitals. And Hearth brings together 10 core partners, so 6 academic institutions. So Ruth Doherty is from Edinburgh is part of that. Anna Mavriani, who's part of HESTIA, is also part of Hearth. And we have 4 public sector participants as well. And we have 34 project partners, as you can see in the UK map, from all devolved nations in the UK. We have 5 technical work streams and 3 cross-cutting themes. Very briefly, just to give you an idea of what that's about, we start with looking at climate models, but more in terms of heat and co-occurring events. We have a plan of work to look at monitoring and modeling outdoor environments, because obviously heat is associated with indoor and outdoor exchange. And then we have a detailed program of work looking at indoor exposures to heat, followed by evaluation of interventions that are being implemented currently and those planned for future. And all this technical work is underpinned by development of new indicators, metrics, knowledge mobilization activities as well, and a lot of stakeholder engagement and with public members as well. The photograph you see here is the in-person launch that happened in May this year. It was a 2-day event, and we had all project partners there as well in Oxford Brookes. I'm going to stop here. There's a website for Hearth, hearth.ac.uk, and the QR code will take you there. I think I'm going to hand over to Ruth now for INHABIT.
Hi everyone, and I think so I'm representing on INHABIT. I think the director and PI of INHABIT, Jean Bourgie, is actually in the audience. So if you want to say anything, Jean, please feel free to turn your camera on or say hello. Also have co-directors James Milner. James, if you want to put your camera on too. And Anna, I think, can't be with us today. So we're a hub that's part of 10 universities and I think 42 project partners in local authorities and governments, and as shown in this figure here. So what's INHABIT going to do? Well, it's another one of the hubs that were funded under the UKRI and IHR, called on realising the health co-benefits of the transition to net zero. Hearth, as Rajat said, has a focus on extreme weather. INHABIT has a focus on the indoor environment. So the idea is to bring together evidence or derive evidence, bring together evidence to enable policy relevant solutions where we put health at the centre of climate change mitigation in the housing sector. And we have a QR code there for the website. Just a little bit of detail about how we're organising INHABIT. Again, it's a hub, not a project. So it involves a lot of work together collaboratively. So we have systems thinking. I think, Nigel, you might also be here. So hello, which you're in charge of. Observational evidence is work strand 2. We've just delighted Jumbo and Bowen and Rajat have just heard, conveyed the news. We've got ethics clearance to go in, ethics approval, sorry, to go into 200 or more homes, which is a real, that's maybe something we all have in common about access to the indoor environment. Work strand 3 is trying to develop a model framework that covers research and enables coupling with the indoors and the outdoors. Anna is in charge of thinking about interventions, new and existing, that will help deliver net zero, but where we can also input from a health perspective. now we have a very valuable work package where we talk about what's happening in the real world and what our local authorities' challenges are and how we can interact with them. We've also got cross-cutting themes, but they're operationally based around public participation and ECR growth, so synergies there with Amber, and a cross-cutting theme of a scientific theme of inequalities. And here was our launch in Birmingham last August. We've got some of our team here. So thank you very much. And I think I'm handing back to you, Doug, briefly.
Yeah, thank you very much, Ruth. And now we've got a session with 3 of HESTIA's sister networks, also funded through EPSRC. So I will pass over to Bruno Fraga to walk us through BreatheIn.
Hi, everyone. I'm Bruno Fraga, and I'm here to introduce BreatheIn. Next slide, please, Doug. So BreatheIn is another micro network plus funded by EPSRC, and it's based at the University of Birmingham. We have a diverse group of academic collaborators and partners, including the University of Oxford, Cardiff, UCL, Bath, and Nottingham, and a series of partners within the public and private sectors. In terms of our motivation to put together this network, we have a lot of points in common with HESTIA. We basically want to bring together a community that is separated by disciplinary boundaries and also by sectorial boundaries. And we want to be able to co-design solutions to create healthier indoor environments. That's our focus. And in the next slide, I'm going to talk about some of the activities we have planned. So there are several activities that we proposed. One of them is that we are co-organizing and coordinated our webinar series with INHABIT and HESTIA. So next month in January, in the new year, we will be hosting the next episode of these webinars. We also have a program for early career researchers in a similar fashion to what Amber told us within HESTIA. We have a mentorship scheme in which we will pair early career researchers with more established researchers. And we also have a bursary scheme because we are proposing a series of events that are in person, and we know that sometimes funding is not so easy to get for people who are starting in the academic world. And the bigger or perhaps the more relevant events that we are organizing in BreatheIn are the sandpits. The sandpits have a double component. On the one hand, they are a networking collaborative event that will take place in person in Birmingham. We are organizing 2. One will take place probably late April next year in 2026, and then another one year later. The first one has cross-cutting themes of diagnosis and monitoring, and the second one will be focused on prevention and interventions. So again, this will be in-person events where we will get together. We will have some speakers and sessions for networking to shape ideas, and following those sandpits, some of these ideas, incorporating the reshaping and the recently created collaborations, will be submitted for funding, and we will fund a series of feasibility studies where we are looking for novel ideas, high risk, high reward, and we will be funding 2 categories of projects, small projects, so to speak, up to 36K full economic cost, and large projects up to 72K in these 2 rounds of sandpits. This is all from BreatheIn. I hope to see you in the next webinar, and thank you so much. And if you want to get in touch, just email me.
Thank you very much, Bruno. I'll pass over now to Ellie, who will be presenting on behalf of AirHub.
Thank you, Doug. So, hi everyone, I'm Ellie Hames, Project Coordinator for the EPSRC micro network AirHub here at the University of Sheffield. So the network's led by Abigail Hathaway, along with our leadership and research team, who have a very diverse range of expertise, from engineering to behavioural science to clinical medicine, just to name a few. We've also got many partners, a lot of whom you can see listed along the bottom of the slide. And if I could just ask you to change to the next slide, please. Thank you. So AirHub focuses on indoor particulate matter, particularly PM2.5. So we already know that PM2.5 is strongly correlated with poor health outcomes, but the majority of this evidence is focused on outdoor air quality research. So we actually know surprisingly little about what PM2.5 is like indoors and therefore its toxicology. So on the left-hand side of the slide, you can see a little flow diagram that outlines our 4 key approaches to this research, which are air, people, health, and engineering. And inside that diagram are the central questions that are going to be driving our work. So how much PM2.5 is indoors and what is it made of? What are the specific health impacts of indoor PM2.5? And what are the most equitable and effective ways to reduce these impacts? On the right-hand side of the slide is just a quick overview of our planned activities. So we'll be working closely with the co-design group, which will be people who are particularly vulnerable to poor air quality, to understand what their priorities are, their experiences, and how they can really get involved in shaping this kind of research. And those insights will then directly inform our activities, our workshops and our sandpits. We'll also be running training and ECR networking days alongside monthly webinars in collaboration with the other networks that are also supported by UK IEG. So in terms of what's coming up in the very near future, we've got a couple of events already planned that you can see on the screen. So on the 5th of February, we've got the online health impacts workshop, which is free to register for now on Eventbrite. We've got a workshop in late spring coming up on UK longitudinal cohort studies and an ECR career workshop also scheduled for late spring. So that's pretty much all I can fit into this little snapshot overview of AirHub, but please feel free to reach out if any of this sparks your interest, and we will have a mailing list ready to sign up for early in the new year so you can keep up to date with all of our activities. So thank you, Doug.
Thank you very much for that, Ellie. I'm just passing over now to the last of our sister networks, to Satika, who'll talk us through GREENIN.
Thank you. So my name is Satika Lynch, and I'm the Network Project Officer for the GREENIN Micro Network Plus project. Can I have the next slide, please? So GREENIN is an initiative that has been funded by the UK Research and Innovation, but specifically ESPRC. The project started in October this year and will run until September 2027. It's led by Professor Prashant Kumar from University of Surrey and his counterparts at the University of Oxford, Bath, York, Cranfield, as well as the UK Centre for Ecology and Hydrology. We also collaborate with several non-academic institutions such as local governments, charities and businesses. GREENIN is an initiative exploring how indoor plants can improve indoor environments. The project will assess how effective plants are in purifying the air, regulating temperature and controlling humidity. It will also explore how building design, construction materials and human activity influences their impact. Can I have the next slide, please? The overall objective of the project is to build a network of multidisciplinary specialists, conduct studies to increase knowledge in the indoor GREENIN space, and create practical guidelines for building designs and promote wider use of GREENIN for better environment and public health. In terms of project activities, we will be running monthly seminars similar to this one throughout the project life cycle. And all this information can be found on our website. Additionally, we are currently conducting rapid reviews in this topic area. These reviews will identify knowledge gaps and subsequently provide research recommendations. We're also planning, at the planning stage of running 4 workshops. These are designed to support collaboration and provide a platform for stakeholders to exchange knowledge and generate new ideas. The GREENIN project will also fund 3 to 4 sandpit case studies where people from different fields are brought together to develop practical solutions for indoor greening. You can get involved in our activities by becoming a member on our website. Membership is free. You can follow us on social media and, of course, attend our webinars as well. Can I have the next slide, please? So our current major activity is the mini fellowship. We're currently offering mini fellowships to support short-term placements, training visits and skill development. Each fellowship provides up to £2,000 of non-salary costs and is open to UK-based GREENIN members from both academic and non-academic sectors. The goal is to foster collaboration in this area. The applications for the mini fellowship are currently open on our website, and the deadline is 31st of January 2026. Can I have the next slide, please? So there's plenty of more information on our website at www.greenin.uk, and I encourage you to visit it. And that's all from me. Thank you for listening.
Thank you very much for that, Satika, and it's really great to hear how much momentum there is in this space at the moment and lots of different projects working together. It's my real pleasure now to hand over to Dr. Tiffany Yang, who is the Programme Director working across the Born in Bradford family of projects, and she'll be presenting today on inequalities in indoor air pollution. Tiffany, the floor is yours.
Thanks, Doug. So good afternoon, everyone. Thank you for having me. I'm very pleased to showcase some of the work that we've carried out as part of the INGENIOUS project, which looked at the sources, transformations, and the fate of indoor air pollutants in homes. And today I'll be focusing on some of our recently published work looking at inequalities in indoor air pollution. I'll then segue into our new NIHR-funded Healthy Homes project, which looks at the impact of retrofit on the indoor environment, including air pollution, carbon emissions, health, and economic outcomes. Next slide, please. So first, a little bit of background about where the INGENIOUS study was carried out. So this work was set in Bradford. It is a large city located in the north of England with a very multicultural population, with just under 60% identifying as white British and a quarter as South Asian. The city has high levels of deprivation, ranking 13th most deprived local authority in England, and about a fifth of the residents live in fuel poverty, and it has higher than average rates of illness. The city also hosts the Born in Bradford Applied Research Program. This BIB research program aims to identify the factors that can influence health and explore ways to improve the health outcomes for our families. Next slide, please. So BIB is an applied research program. We first actually started out in life in 2007 as the original BIB cohort. We followed the lives of over 12,500 women and children, and since then have built a research program to include 3 birth cohorts, a connected Bradford data set, which links routine health, education, social care data for over 700,000 Bradfordians. And we have built in a very quite expansive program of research, which ranges from diets to nutrition, obesity, to physical activity, health inequalities, mental health, co-production, and very strongly in understanding how various aspects of the environment can impact on our health, including outdoor air pollution, and also to evaluating interventions like the Bradford Clean Air Zone. Next slide, please. So with that little bit of background on where this INGENIOUS study is set, let's go back to the research a bit. So we know that air pollution is harmful to health. Much of the research on air pollution has focused on the outdoors, and understanding what happens indoors is still quite limited, despite people spending up to 90% of their time indoors, and much of that inside their homes. And there is already evidence that there are inequalities to outdoor air pollution, with socioeconomic and ethnic minority groups disproportionately exposed to higher concentrations. So in this study, what we aimed to do was to recruit and monitor air pollution levels among families from our BIB cohort in order to look at the concentrations of pollutants observed inside these real homes and whether the concentrations differ by known determinants of health. So in this case, we looked at ethnicity, area level deprivation, and housing tenure. So this work was carried out by our principal research fellow, Rachel Chung, and was recently published, and I've dropped a QR code in case you want to have a look at it. Next slide, please. So we recruited our participants for this real home study from the BID families. The aim was to recruit 300 families and then install air gradient sensors for 2 weeks to measure concentrations of PM. Each home had 3 of these sensors located in 3 locations. One was in the child's bedroom, one in the kitchen, and one in the living room, and these were left in place for 2 weeks. For the results that I'm going to show in a moment, these were then averaged per home. We also deployed a variety of surveys on different days to gather information on home characteristics like household size and occupancy, building characteristics, and resident health and behaviors. Next slide, please. So for each home, we calculated 3 indoor PM metrics. We have the mean daily average PM concentration. This is a 1 metric per home, and it's the average across all of the monitored days. We have a percent daily average concentration. So what this tells us is the percent of days spent over the WHO 24-hour threshold of 15 micrograms per meter cubed. And then we also have a percent hourly average. And this tells us a percent of hours spent over this threshold of 100. And it's used to really indicate time spent at a persistently high threshold. And in this particular work, it focused on describing the indoor concentrations across all homes in between 3 key determinants, so ethnicity, housing tenure, and deprivation, which here is measured by the index of multiplied deprivation. It's a geographical measure of relative deprivation by living area, and it's been rescaled into Bradford. Next slide, please. So in total, we recruited 321 households between March 2023 and April 2024. These were fairly distributed across the seasons. About 31% were monitored in the spring, about a quarter in the summer, and about 22% each in the autumn and the winter. 309 of these homes had at least 7 days of valid data and were then included in the analyses, the results of which I'll show in a moment. And in terms of who else is in our sample, we have about half of our sample were of South Asian ethnic origin, 41% white British, and 10% other ethnicities. And 3/4 of our families reported living in private housing. So this is either mortgaged or living with a person with a mortgage, with the remaining living in rental houses. So this includes both private and social housing. Next slide, please. So when we look at our air gradient results, what we see is that we generated about 3.5 million observations, and households were monitored for an average of 13.6 days. Over the 2-week period, the mean daily indoor PM concentrations across all homes was 20.2. Now, we have a rough estimate of home occupancy, which suggested that participants were home about 3/4 of the day, which suggests that homes are likely to be a not insignificant source of exposure. For the other measures, we found that on average, homes spent 41% of their monitored days above this recommended 24-hour threshold. And this ranged from 0%, so none of the time for 37 homes, but for 20 homes, they spent 100% of their monitored time above this threshold. For our measure to indicate time spent in high levels of PM, we found that on average, homes spent 4% of monitor hours over this threshold, with 21 homes spending no time, and 1 home spending 68% of their monitor time over this threshold. Next slide, please. Okay, so what about PM concentrations by ethnicity, housing tenure, and IND? So this slide shows box and whisker plots for daily average PM and percent monitored days exceeding the WHO threshold. And these are on the y-axis. And then on the x-axis, we have them split into the 3 ethnicity groups. And what we can see here is that South Asian homes have higher PM than white British, so 23.5 compared to 17, as well as other ethnicities, which is at 16. And that we find a similar in terms of the differences for the percent of monitored days exceeding the threshold, with 51% of South Asian families spending their time, 51% of the time of South Asian families were spent over this threshold, compared to less than a third for the white British and other ethnic groups. Next slide, please. So this figure shows the same thing with daily average indoor PM on the left, the monitor days exceeding the WHO threshold on the right. And we can see here for housing tenure that PM 2.5 concentrations are higher among those living in rented rather than owner-occupied for both the daily average concentrations of 24 versus 19, as well as the percent days exceeding this threshold at 15 at 51% of time versus 38% of time. Next slide, please. And then finally, when we examine these metrics by quintiles of the index of multiple deprivation, we can see a very clear trend with increasing PM 2.5 levels and percent of monitored days spent over the WHO threshold with increasing quintiles of deprivation. So among the least deprived, thank you. Among the least deprived, we see that the average daily PM 2.5 is about 13, whereas this is about 24 for those living in the most deprived. And those living in the least deprived spend a quarter of their days above the threshold compared to half of those living in the most deprived. Next slide, please. So we also explored household size and the average hourly PM across the 2-week period. So in this figure, time is on the x-axis in 24 hours. Mean hourly average PM is on the y, and we see different household sizes shown in various colors indicated in the legend. So what we see here is a clear demarcation of households of 5 or more having higher levels of PM than those with households of 4 or fewer. And when we looked at household size by ethnicity and deprivation, we found that both South Asian households and those who lived in more deprived areas had higher household sizes. So this might go part of the way to explain the results that we've seen. Next slide, please. So overall, this study found that there are high concentrations of PM in homes, and that homes spent 41% of their days above the WHO recommended thresholds. And with participants reportedly spending 3/4 of their time in the home, this is the potential for household members to be exposed to potentially high and harmful levels of PM. We also found that PM were higher among our South Asian families and those living in rent accommodation and those living in more deprived areas. And that some of this might be influenced by the overlap between these, with South Asian homes and homes in more deprived areas having larger household sizes. And also that 60% of our South Asian homes were in the first or second most deprived quintile, while this is only the case for about 29% of our white British homes. So our study doesn't examine the differential contributions of each of these to the observed PM or the interactions between them, but it was really carried out for us to be able to illustrate the levels of PM observed in real homes and also how the patterns of indoor PM might differ by these key social determinants. Our findings indicate that there's a clear need to raise awareness and to address indoor air pollution and also consider actions on how we can reduce these risks. And this work can definitely benefit from further investigation in larger sample sizes over a much longer period of monitoring, and also taking into account how buildings and occupant behaviors can impact on indoor air pollution concentrations. And some of these points can be addressed in our new NIHR-funded Healthy Home Study. Next slide, please. So our Healthy Home Study is looking at what happens as a result of retrofitting social housing. We know that housing is an important wider social determinant for health and well-being, and the design and the condition of a home is likely to affect not only the air we breathe in, but also the home's energy efficiency. So this will then shape carbon emissions, resident experiences and comfort, and overall health. This is a 4.5-year project. It is co-led by myself and Professor Rosie McKechnie at Bradford, and it has started just this past July. And several of our partners, well, Doug is on the call. Doug is one of our partners on the study. Next slide, please. So don't need to go through into this again, just to note that housing is an important contributor to to emissions. It's important that they are being brought down. Retrofitting existing housing stock to meet this minimum EPC, Energy Performance Certificate of C, will help decarbonize housing, which is only currently met by fewer than 50% of housing stock. We know that housing is an important factor for health and well-being, and that housing-related illnesses, including excessively cold homes, is able to cost the NHS in excess of $1 billion a year. And while retrofit is seen as a solution to making homes warmer and reducing energy costs, but there are still many unknowns, such as what if there isn't adequate ventilation with increasing insulation? There might be a risk of moisture and air pollutants being trapped inside homes. Or we may not see an expected reduction in carbon emissions if residents decide to take back the energy savings that follow a retrofit. Next slide, please. So our Healthy Homes project was developed to build this project around retrofit and air pollution, evidence-based, and help answer some of these unknowns. The opportunity to develop this project came about because INCommunities, which is a large Bradford social housing provider, are in the process of rolling out retrofits to bring all of their non-compliant properties, about 9,000, up to this minimum EPC C level. They're currently in the first year of a 3-year funded cycle of retrofit, during which they will retrofit just under 3,000 properties. So that we've managed to hook onto here and then develop a project looking at what happens as a result. Next slide, please. Very quickly, there are 4 work packages in Healthy Homes to help us examine the impact of improving the energy efficiency of social housing. So the first is a quasi-experimental controlled pre-post design. This is going to focus on what happens indoors, to the indoor environmental quality, to resident health and thermal comfort, to the energy use, and then also whether there are any of these unknown, unexpected trade-offs. And this will be done via data collection, which I'll explain very shortly. The second is a matched cohort study, which is going to look very much longer term to understand how respiratory, cardiovascular, and mental health and healthcare use changes following retrofit. This is going to be looking for the retrofit of the over 3,000 homes, and we'll be using the in-communities housing data, which will be linked to routine health data held in our connected Bradford database. The third is going to be using data collected from this bespoke data collection within homes, and is going to carry out building modeling to estimate changes in indoor conditions and carbon emissions for a wide range of archetype properties and examine if we can extract criteria for prioritizing future retrofit interventions. And we will also quantify the lifetime economic and health impacts and compare the estimated health and economic benefits relative to the cost of the retrofit. Finally, there is a systems-oriented process evaluation to really understand how residents and stakeholders experience the intervention and explore interacting contextual factors which may have impacted on its implementation and outcomes. Next slide, please. In terms of current activities, we are now in the sort of tapering edge of recruitment for this monitoring phase. So the recruitment is due to end pretty soon. Our aim is to recruit a total of 420 homes and place one of these air gradient sensors into the home, into the living room. We started recruitment in the summer. These sensors were then left in the living room, and we plan to leave them in the homes until spring 2027. So this gives us about 18 months worth of continuous data. Half of the homes will be our intervention homes, which means they will receive a retrofit between March and October next year. And the other half, our control homes, they will receive a retrofit, but it won't happen until our monitoring phase ends after spring of 2027. So what this means is that we will have data across not just 2 winter periods for comparison of pre and post retrofit measures, but also summer data. So we can look at the impact of retrofitting on summer conditions, the risk of overheating, for homes who receive a retrofit before summer. Our primary outcome is to look at temperature, and we hypothesize that the objective temperature shift would impact on subjective thermal comfort, and which would have then knock-on effects on resident health. And we also have a wide range of other outcomes of interest, including indoor air quality, mold risk, both monitoring and modeled, and whether there are any changes in energy use and therefore carbon footprint, if there might be a take-back factor at play. And of course, how do residents experience the retrofits, and how do these retrofits impact on their thermal comfort and their health? Next slide, please. This is just a quick sneak peek at the early data coming out of the first 100 odd of our monitoring properties. There are just 2 main things to note around temperature and PM levels. As we progress from left to right, from summer into the cooler months, you can see in the red the drop in outdoor temperatures, and then a slight drop in the indoor temperatures of the homes. But what is concerning is there are quite a few properties dropping below this dashed green line, which is 18 degrees, and this is considered a minimum for healthy adults. And that you can see there are homes that are coming closer to 10. And from the bottom figure, this is looking at hourly PM levels. And the y-axis is truncated, but what this really illustrates is that there are some very high levels of hourly PM, with some exceeding 1,000. Next slide, please. Thank you for your attention. For my collaborators and our excellent recruitment team at BIB, I'm really happy to respond to any questions you might have.
Thank you very much for that, Tiffany. I've got about 1 million questions, but this isn't just about me. I'll go first to the Q&A. We've got a question from Mark Humphreys that's asking whether the whisker charts indicate no statistically significant difference by ethnicity or tenure. So perhaps I can go back to, I think these are probably the figures that Mark is referring to, Tiffany.
Yes, so it is statistically significantly different. So we see that the p-value between South Asian and other is 0.004, and between South Asian and white is 0.001. So it is indicating for the figure on the left that we do see statistically significant differences between ethnicity for South Asian versus white, South Asian versus other.
Thank you, Tiffany. Do we have any other questions in the audience, Tiffany? You can either put something in the Q&A. So there's one in the chat from Zongbo Shi asking, will the air quality sensors be deployed in all homes all the time, including the control homes all the time, i.e. 2 years?
Yes. So we basically, from our in-communities housing collaborator, they provide us with property lists of who they are expecting to retrofit in which of the 3 years of their program. And from there, we can recruit both control and our intervention properties. And the goal was to have all of the sensors in place before this winter period really got going. And that way we would have this full winter period to look at before and after, but also between during the winter periods.
Thank you, Tiffany. Got another question from Kate de Sellingport here. With the ongoing study, how much detail about measures installed will you have access to?
We have a great relationship with the social housing provider, and they are very good about being open about what is being installed. So we have not only have an idea of what they were thinking of, but because all properties have sort of a bespoke retrofit design, they identify potentially eligible properties. Then they have a contractor go in to assess the EPC and then do the appropriate design for that property. A separate contractor goes in to do the retrofit works, and then the original contractor goes back in to check the works. And all of the information that's through the design to what was put in is all being collected, and we do expect to be able to receive that information.
Thank you, Tiffany. I think we've probably got time for one more question. Anyone has them? Otherwise, I don't see anyone frantically typing away. We'll wrap up. Thanks again, Tiffany, for your lovely presentation. Just like to flag that this is just before the break, but there'll be some great things going on in the new year with HESTIA. So we've got our network launch in Leeds in January of 2026. If that's of interest, I'd say please get in touch with me or Denise Groves, our network coordinator. Helen mentioned the sandpit, which will be summer 2026, but our sister networks also have some going on. So please do engage. It's a great opportunity for some collaborative research. And I'd just like to say thank you for joining us today, and we look forward to you coming on this journey with us to ensure healthy homes for all. Thanks.